Good morning. I am Rajeshwari. I am pursuing PhD in Amity College of Nursing. As part of my study, now I am going to show you how to do baby massage on infants with hyperbilirubinemia. So coming to the demonstration, so here before we start we have to ensure that we wash our hands, dry our hands, and then we also see that the baby is calm. So if in case baby is cranky or if the baby is crying, so we have to make sure that the baby calms down before we start with the demonstration. So first we are going to do starting from the face. So in face we will see that we will be doing below the eyes, and then we will be doing on the cheek. Next we will be doing it on the chest. Thereafter we will do it on the intestines, then on the upper arm, then lower arm, heel of the baby, and then at the neck of the baby. So these are the different parts how we are going to do. So basically when we do, we either use thumb or we can use two fingers, that is the index and the middle finger can be used when we are going to perform this massage on the baby. So firstly, as I have told before, first we will do it below the eyes. So here we have to be careful that when you start to do, you have to give gentle strokes and it should go above the ear and behind the ear. So this massage when we are performing, we are going to drain where the limbs are, because that is going to be beneficial for the baby's blood flow, and it also strengthens the immune system of the baby. So we have to start from below the eyes, give gentle strokes, take it back of the ear and drain it behind the ear. So this is how we are going to give the massage on the face. So next, this we'll have to do it for about 5 to 7 strokes. After the eyes, it is the cheeks of the baby. So we have to give gentle stroke with the two fingers and drain it behind the ear. So we take it softly and gentle strokes behind the ear. So this also we have to repeat 5 to 7 times. In case if the baby becomes cranky in between the procedure, we have to just give gentle strokes on the baby so that the baby calms down. And once when the baby calms down, next we have to concentrate on the chest. So again, chest we can divide it into half. So either we can do it on the left side and then we can do it on the closer side. So here important thing that we have to keep in notice is that we have to give little pressurized stroke from outside to inside of the baby. So why are we doing this? This stroke will help to drain the blood, or it improves the backflow of the blood to the heart of the baby. So this again has to be repeated for about 5 to 7 strokes. From the outside to inside, and we will have to apply slight pressure. It is not going to be a gentle one, but then slight pressure should be applied from the outside to inside of the chest of the baby. So once when the chest is done, we have to concentrate on the intestine. So here intestine and the digestive system. So again here we have to divide it into half. So here we can use two fingers and then clockwise we have to give slight pressure. Applying slight pressure, you have to do the massage clockwise for about 5 to 7 strokes, and then we go anti-clockwise 5 to 7 times on the baby's abdomen. So once when half side is done, we will concentrate on the other side, proximal to distal. So here we see that, again we start giving strokes clockwise motion to the patient, to the baby. 5 to 7 gentle strokes, and then we give anti-clockwise stroke on the baby's abdomen. So once when it is done on the abdomen, we move on to the upper extremities. So here we have to make sure that we do the massage and drain it on the lymph nodes. Again proximal to distal. So making sure that we cover all the area 5 to 7 strokes can be given. So this is how we finish. So first we finish on the farther side and then to the closer side. Next, coming on to the lower limbs. So lower limbs, there are two techniques which can be used. So either first you can divide them as upper lower, and then you can do it on the lower side, that is above the knee or below the knee. Okay, so first we do it on the farther side and then we do it on the closer side. So here we can do it from above the knee, or you can do it from the ankle straight, draining into the lymph nodes. So if in case if you are going to divide half, then it would be done like this. So draining into the lymph nodes. Again, this has to be done 5 to 7 times. Or if we are going to do from the ankle to the inguinal area, then slight pressure has to be applied on the baby's inguinal area. So repeat the same on the closest side of the baby. So coming on to the last, on the lower extremities, it is the heel. So heel also, you have to just hold the heel and give gentle stroke to up from heel to the feet of the baby. So any time when the baby gets cranky, we have to give gentle strokes for the baby, which would calm down the baby. Or we can even, if not contraindicated, we can even turn the back of the baby and then gentle strokes can be given to calm the baby down. At the end, we have to do it on the neck. So either we can hold the baby's head and then we can do it halfway. So we can again divide and half side and drain it behind the ear, and then the other side can also be drained behind the ear. As we do the massage, we take 5 to 7 strokes and then do the massage and drain it behind the ear on both the sides. Or as one stroke, we can also do from the other end, we can drain it to this end. So this is how we are going to perform the baby massage on the baby. So we have seen, to summarize, first we have seen it has to be done below the ears, so below the eyes. So when we do it below the eyes, so we make sure that it is drained up and behind the ears and on the cheeks. Again, it goes down the ear and above the ear. And then we have seen how we have to do it on the chest, abdomen, upper extremity, lower extremity, heels, and then with the neck. Thank you.